What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. And today we will do stuff that annoys your X-ray tech patients, those who are new to the community of the button pushing of X-ray tech students, or those who wish to get into our field. Because those who are in our field, you might as well just skip the video because you already know the struggle. So I would say amongst the biggest complaint our patient is, especially if you're doing a chest x-ray, more with old people, is you'll put it back there and they'll be like, it's too hard, it's hurting my back. That's one. Or if they have their little gowns, it's so cold, and they'll like jump up, like they'll get you up in the morning. They'll say that a lot. Or what's another infamous one? And then occasionally they'll be like, it feels good. It feels nice and sturdy. And then for all the patients in ICU or who are intubated, they don't like our board, you can just put it in there and then they're like, beep, beep, beep. Like they start like, jerking and stuff. And then the nurses become like, what you do to my patient? Blah, 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 blah. They don't like it. Sometimes you just pull up to the room, don't even touch them, and they already start beeping or they start jerking and stuff. And I'm like, it's like they know we got here. I'm like, we didn't even touch you, sir. Ma'am, they literally will do that to us. And I know sometimes the nurses get mad because they're like, as soon as they see us, they're like, damn, they're about to wake up, they're about to piss off my patient. And I'm like, well, I'm sorry, the doctor ordered it. And then the patients get mad that you have to do x-rays in the middle of the night, and they never understand the workload you have to go through to be able to do the whole hospital and stuff like that, so they'll get mad. Or they'll always do a lot of like jokes about radiation, but that's not really the annoying part. Or they'll get annoyed that they had so many x-rays done. And why are you doing it? And then you're like, well, you have chest pain. And they're like, oh yeah, that's right. And I'm like, sometimes I feel like patients, there's nothing wrong with you asking you why you getting it done. But like, especially if the morning ports, like I'm not going to remember 30, 40 patients reasons for doing your exam. Like, I'm sorry. Like I'm literally, it's impossible for me to know the amount. Like, we have so many to do, we just make sure you're the right patient, we'll do it. And then there's the patients who will tell you, why are you doing it? I know it's broke. And then you're like, well, that's why we're doing it, to know how broke it is. Like, God, what do you want me to do? And then there's the patients, the little kids, especially, like, because the nurses will terrorize them. And then you come in just to take the picture. They'll be like, the light will get them and they'll start, moving around. Or like, they feel like you're gonna hurt them. But some of them are tiny, so they don't understand. But that's kind of another thing that they will do. Let's see what else. Or they'll get mad that when they broke their hip and you gotta shove the board underneath them. And they're like, please don't shove it in there. I'm like, sir, this is not a trauma bed. This is how we get the picture. You have to be touching it so we can look how you do it. And they'll complain about that. Or about the positions we do and how hard the table is. And that's another kind of common thing you'll hear all the time. Or they'll complain about you not letting them see the picture, or that their families works in the radiation field and they don't think it look right. Or they'll complain about how you're not telling them if it's broken or not. What else? Or another one they complain about, they'll be like, well, you're doing an x-ray in my hand. My shoulder has been giving me issues for years. Can you X-ray that? And I'm like, ma'am, you came in here because of your hand. Why you gotta give us more problem with your shoulder? So that's like another thing that will happen. They'll tell the doctor, and then you have to do a second trip, and you're just like, why didn't you just tell the doctor? That also hurt. You could have gotten out of the way, or you could have went to your primary care provider. Sometimes they'll do it, and you can see the doctor's face like, they're not really why you're here, but I guess we'll do it anyway since you're already here. I guess that bothers also the doctors too, and they'll tell us all the time. Let's see what else. Having to stand. Some of these patients will complain that they can't stand, and certain exams are quote unquote supposed to be standing, and they want you to do it on the portable, and you're like, ma'am, you're too big. This T-spine, this L-spine, and not gonna be a good picture if we do portable. But they don't understand that. They'll complain all the time because get on your hard table. Let's see what else. It's another common one. I think those are like all the big ones I could think of at the moment. But yeah, most of the time, especially if they're in pain, or they'll want drugs first before they do the X-rays. Which I understand why the doctor does that, because they want to see how broken it is to determine what kind of drugs and medicine and stuff like that. But there's some patients that their pain tolerance is different, because sometimes their bones will be just destroyed and they'll just be there. You do another patient's like you don't see anything, nothing wrong, and they can barely just move anything, and cause pain. So you'll see different levels of pain on that. For the people who don't let you shoot their X-rays until you get drugs. That's another big one right there. Or the people that complain about leg swelling, and then we do a chest X-ray, and then we have to explain to them that sometimes your leg swelling means that you're having chest problems. It's another common one that happens. Or when the doctor just orders stuff without seeing them, and they'll complain like, I haven't even seen a doctor yet. Why are you doing X-rays? This doesn't even need X-rays. And we were like, you know what, ma'am? You're right. If you don't want it, we don't gotta do it. You tell your doctor you didn't want that X-ray. Let him know. Certain doctors, you already know they don't see it because they'll be out in the waiting room and they'll just start ordering a bunch of shit because they just want to have everything before they see him, so they can just be like, okay, well, the results say blah, 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 instead of assessing their patients and doing it properly. Some doctors are known like that. And other doctors don't even know that they put in orders, because if the certain patient has certain things and there's like a little order set thing, just automatically order stuff for them and they don't even know. That surprises me sometimes. But yeah, it's been your boy Miguel. Hope you enjoy your daily dose of radiation. See you on the next one.